there was a day that we talked about time management and the importance of it. And something that Dr. Rain said and emphasized with the program is time is your biggest asset in life, and really taking advantage of that time to optimize everything that you're trying to do in life. When you use those words, it really helped me lay out my priorities and how I manage my time, because that's something I've always struggled with, and how I prioritize things to fit what I need out of my life. I really enjoyed the in-person sessions with Dr. Rains. He's someone that interacts with medical students well and understands. He's very good about putting himself in medical students' shoes and sharing experiences of burnout and imposter syndrome, things like that. Yeah, I'd say it definitely has it gave me a small community and safe room to talk about certain vulnerable aspects of my life, because we met in really small groups of people that I was really familiar with, that were also interested in participating in the program, and therefore they were a lot more involved in it, because it was a voluntary thing. And adding in Dr. Rains, who's willing to be so vulnerable, like Colby said, it just gave it a good safe space to talk about those things, because we do have programs in our medical school to do that, but the way they're presented and the way that they're organized, they don't appear to be as accessible as they probably are. In terms of fitting into the culture, I feel like that's probably a big problem, is that culture isn't built to have something like that built into it. And so by like trying to implement it into such a fast-paced culture, I think that's the important part, is getting that conversation started and making sure people are trying to implement that mindfulness into their daily routines, or the way they cope or deal with certain difficult aspects of their lives, because it's not talked about enough. Like you said, there is a stigma, especially in medicine. We're expected to be on a lot of the time, devote a lot of our time to our jobs instead of ourselves. We take care of other people. And so it is an important conversation to have. And I'm glad people are trying to do that, and it's changing a lot now. The way that it's all modeled is a lot of self-reflection, and I think that's something that's really important for me, that I've implemented into like my year so far as a surgery resident, because I'm it's such a social job. I'm with people for like 12 hours a day, and so that little bit of time I get to myself, I'm reflecting a lot of that time. And so to be able to have the right guidance to do that in a positive way and not in a harmful way to myself is really important, and that's served me pretty well so far.
It caught me at a really opportune time, actually. So I had just come off of studying for a big test, and that we have in med school. And had developed a bunch of bad habits, and had really ran myself into the ground for that test. And in doing so, I had not only burned myself out, but put myself, like I said, in both a mental headspace and a habit situation that was really unhealthy for me. Drove me to like sort of not only a burnout phase, but like components of panic, depression, suicidal thoughts, those sorts of things. And growing up, I really had never been given any sort of like tangible tools to use to both manage those sort of situations, but also prevent it. And it just happened to be that I went through my surgery clerkship with Dr. Rains, and his vulnerability about kind of his struggles that he went through, paired with the program's curriculum, really helped give me some concrete things to latch onto in that season. It really helped me get through it. And then now that Amy and I are residency, things are just get harder in different ways. And so I feel like it's really equipped me to not only get out of ruts when I get in them, but prevent me from getting in them in the first place. And then second thing I think you did, especially with Dr. Rain's involvement, is be more vocal and open about the experience that I had, and more willing to share with others that are sort of struggling in that situation, in kind of the way that he was able to do with us when we went through the program. When we were, around the conference room, everyone kind of had a shared understanding that like we're all here to like see what this program, see what these things are about, and get like better ourselves, and ultimately help like better the care we can provide to patients. And so I think for me, the big takeaway was it demysticized and it made wellness bite sized. So it took this like kind of kumbaya like uh, not as scientific sort of thing, and it made it a little bit more like straightforward, easy and simple to do. There weren't any like big promises attached or anything. It was just like, this is a this is only going to be a net positive sort of situation. And then there were simple associated tasks to try, and not all of them like are my jam, but some of them ended up being. And so I think I think that was really nice. As a spine surgeon, I will spend thousands of hours reading books and watching surgeries and blah blah blah, doing all these things to try to be better. But at the end of the day, I may spend 200 hours learning how to like take out a colon. And if you would just spend, even just a couple hours total a week on working on yourself, whether that be with time management, mental health, whatever it is, like that affects every area. That affects every surgery, every patient interaction. And so it because it touches all areas, I think it's a great return on investment for your time.